We know how this virus transmits in sort of hidden ways. Is there a probability that this could enter in Canada? Yes. The only way to stop it spreading is what we've just been harping about and like a broken record.
Canada imposed a 72-hour travel ban on the UK on Sunday. Will it be extended? Bill Blair is the Minister of Public Safety. He joins us from Toronto. Hi, Minister Blair. Good to have you back on the show. Thanks for making the time.
Thank you, Vashi.
Minister, I want to start on the suspension of flights coming into Canada from the UK. That 72-hour ban on those flights is set to expire around Thursday, I think at midnight, so Thursday morning at midnight. When will you decide if it will conclude then or be extended?
Well, as you know, Vashi, we moved very quickly. As soon as we got information through the Public Health Agency of Canada about the new variant and concerns about its contagious nature, we acted as quickly as possible to restrict those flights coming in. We have still 36 hours before that period of suspension elapses, but I can tell you there are ongoing discussions with the Public Health Agency of Canada, health officials in the UK, and with the WHO, and we'll make our decisions based on the best advice available. But I think we've demonstrated to Canadians that we're quite prepared to do what is necessary to keep them safe.
When you say the best advice available, is that advice coming from, for example, Dr. Tam specifically, or who exactly will you be basing your decisions on? What advice?
Yeah, we get our advice primarily through the Public Health Agency of Canada and, of course, Dr. Tam. I know that she's in consultation with colleagues and professionals dealing with this illness around the world. And based on the advice that they give us, we acted very quickly on Sunday based on the advice that Dr. Tam and others provided. And we are prepared to continue to base our decisions, first of all, on the best available science. And secondly, we will always do what is necessary to protect Canadians.
I'm sure you're privy to information that I'm not, but everything I've read so far indicates that this strain of the virus should be okay. The vaccines should still be effective, but that it is more transmissible. So it's more easily passed from one person to the other, up to 70% more easily passed. If that is still the case 36 hours from now, do you anticipate that this decision will stand?
Well, I think it was the right decision on Sunday, and as long as those concerns exist, we'll make whatever decisions are necessary to protect Canadians. I have heard in a conversation earlier today with Dr. Tam, and she's made it very clear that all of the available evidence at this point indicates that the vaccine will still be effective against this new variant, but at the same time, we're continuing to evaluate and monitor the situation very carefully. I think we've taken the appropriate rigorous measures immediately. And we will continue to base our decisions based on that advice, and also, I think, our priority, which is always to protect Canadians.
Just to be clear, though, if the disease, or if this strain of the virus 36 hours from now is still being reported as 70% more transmissible, will you extend the ban on flights from the UK?
Well, first of all, it's a decision that is made in consultation with our public health officials, myself, Minister Hajdu, Minister Garneau, Minister Champagne, in consultation with the Prime Minister, make this determination. Ultimately, it is the Prime Minister's call, but we're all monitoring the situation very carefully, and everyone's fully engaged on this issue. And I have great confidence, actually, in the Public Health Agency of Canada and Dr. Tam's advice, and we're continuing to listen to them as we have done right from the beginning.
How many travelers, Minister, from the UK have entered Canada in the last 2 weeks?
Yeah, on average, about 300 people come in a day. And so let me just talk a little bit about that. On December 20th, when we made this decision, we had 2 planes that were in the air, actually a third one, which was just a cargo plane, but 2 planes that were in the air with 301 souls on board. That includes the air crews of both planes. We took very deliberate and rigorous measures with respect to how we screened all of those people coming in to ensure that they were ordered into quarantine. And we collected a great deal of information through enhanced screening for those individuals. We've also, through our contact and tracing system, have been able to identify those who have come in directly from the UK, and through the Public Health Agency are able to reach out to those individuals to ensure, first of all, I point out that virtually everybody who comes in as a non-essential traveler into this country is ordered into quarantine for a 14-day period. And the quarantine measures that we've had in place since March have been very effective in significantly reducing the threat of transmission from international travel. And in fact, it's it's well less than 2% of all of the transmissions in this country are directly related to international travel. I think that number speaks to the efficacy of the quarantine measures that have been put in place and the rigorous screening that our border services officers do with the Public Health Agency of Canada and the follow-up measures of ensuring people are in compliance with those quarantine measures. It's not an absolute guarantee, of course, but the measures have proven very effective, and I'd contrast it with measures that have been taken in other countries, and particularly in the United States, for example, which did not, unlike Canada, they did not restrict non-essential travel. They've allowed international flights to continue. They don't order arriving international travels into quarantine. We have taken all of those measures, and frankly, they've worked to help protect Canadians.
How much of that comment is directed to the Premier of Ontario? And I ask because I know you're familiar with what he's been talking about the past few days. He has loudly criticized the federal government for a lack of testing, he says, at airports like Pearson. Today, I heard you say in a press conference that was an unfortunate misrepresentation of what is happening at our borders. What do you have to say to Premier Ford?
Yeah, first of all, I don't want to speculate on any motive for the Premier, only to correct, I think, some of the facts which he unfortunately misrepresented at the border. There have been discussions, Vashi, with Alberta. We've got a pilot going there, and there's been discussions with the province of Ontario about testing at the airport. But those discussions with the province were based on their intention to shorten the quarantine period, not to screen travelers. And in fact, when he suggested that it was open and porous, frankly, that does not represent the facts. And the truth is, we actually have in Canada one of the most rigorous border control measures put in place of any country in the world, and it's been effective. Virtually all non-essential travelers are ordered into quarantine, including returning Canadians who, under the Constitution, have a right of entry. More than half of the people that have crossed our borders since we implemented these very rigorous measures back in March are truck drivers. They're the people that are bringing the goods and services and the produce that's on our grocery shelves, the parts to our factories, and move our goods and services. And others have been essential workers, medical workers and technicians who are absolutely critical to the critical infrastructure sectors in this country that are necessary to keep the country moving and keep Canadians safe. And so I want Canadians to understand that we have taken very effective measures, and our border service officers, our public health officials, and working very closely in collaboration with provincial public health officials as well, and local law enforcement of jurisdiction, have been working around the clock to keep Canadians safe. And I want to assure Canadians it's working. We have seen almost like very, very minuscule amounts of transmission related to international travel. And those numbers, I think, speak to the efficacy of the measures we've taken. Now I think testing is a valuable tool, but it actually takes time to get the results of those tests. Our most effective measure, our most effective protection for the interest of Canadians, for any traveler coming in from any international destination, is ordering those people into a 14-day quarantine and ensuring that they follow the rules.
So why is there, Minister, such a gap between what you're telling our audience and what they heard from the Premier earlier this afternoon?
Well, again, the Premier is dealing with a very difficult situation in the province of Ontario. And yesterday he was making what was going to be a difficult and controversial announcement. Certainly, I think that I very much respect their jurisdiction over those measures. They're dealing with that 98% of transmissions that take place in community. But I just want to assure Canadians who may have been concerned or perhaps confused by the statements made by the Premier, and I want them to know that there are very rigorous measures, perhaps the strongest of any country in the world. We have stopped all non-essential international flights into Canada. Canadians, of course, can return and do, but when they return, they're ordered into a 14-day quarantine. As well, our border officers, they speak to these individuals. We gather data on them so that we know that they have a quarantine plan, that they have a safe place to go in quarantine. They're directed and given instructions on how to do that safely, not to go travel anywhere else, and to make sure that they're not exposing themselves to vulnerable people. We record that information. We have a hotline that's following up with people. Almost 7,000 people a day are contacted either directly or a call is left to make sure that they are reminded of their requirement to quarantine. And so that work is being done, and that data is being shared and sent as well to the Public Health Agency of Canada, with the provincial authorities, and with local law enforcement.
Okay, Minister, I'm out of time. I'll leave it there. Thank you very much for your time this evening.
Thanks, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.